The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic is what you need to know if you're considering any type of minimally invasive facial rejuvenation. We are going to give you an inside look at what a medical spa is supposed to look like, what kind of doctors to look for, what kind of technology. Well, there are over 2,500, according to our sources, over 2,500 medical spas that have popped up throughout the U.S. Well, we have scoured the U.S. to find what we think is a premier center. We go out of our way. Over the years, I've had the luxury of infiltrating, going inside some of the most successful, the largest medical spas in the country, meeting the doctors, picking their brains, and looking at the technology, talking to the actual reps from these laser companies. And on today's show, we think we found it. With medical director Corey Moss, led by him. It's the Appearance Care Center. It's right in San Francisco. And I think you'll be amazed and surprised at what you see today. This is one of those hot topics, great shows. We've wanted to do this for a long time, so we went right inside. You'll see the technology for yourself. But here's what we found. And we talked to a lot of patients. We talked to a lot of people. And the perception is that the fillers do all the work. And the perception is that laser technology does most of the work, and they don't realize, and the doctors will tell you, the amount of artistry that goes into creating a natural, youthful appearance. We've all seen that person walking down the street that looks done. They didn't have a facelift, but maybe their lips are too big, or their face looks odd because of too many fillers. That's very important to know, since pricing is about the same wherever you go. So with all things being equal, you might as well go to a facility, a medical spa that has a trained medical board-certified facial plastic surgeon, or board-certified dermatologist, somebody that understands the face and the aesthetics of it, but that do both plastic surgery, maybe some of these low downtime facelifts or facelifts, and the minimally invasive. So that way you get a true assessment of what your options are. Nowadays, chances are you're going to be looking at your face another 40 to 50 years. So it's very important that wherever you go, that you really find a practitioner that not only can show you great results, they have the credentials, but they have all the new technology. But the confusion is, what is that technology? What do you ask them? What do you need to know? That's what we're going to cover today. If you are considering any type of minimally invasive facial rejuvenation, my advice, stick around. Now this story we're doing today, minimally invasive medical spas, very timely because medical spas are popping up, it seems, on every corner. And there's a lot of things that people need to know, I guess, to be careful of. And so today we wanted to visit a real medical spa. Now this is the reception area in the Moss Clinic. You have two. You have two facilities here.
Right. Actually, Randy, we have set up really a comprehensive center. Included in the facility, we have the Moss Clinic, where I do my consultations and do a lot of my surgical practice. Right up the stairs here and contiguous with the practice is the Appearance Care Center.
Beautiful office, by the way. I mean, you could get lost in here. You just kind of walk around, it all flows.
Yeah, well, I mean, really, we've tried to set it up an environment where people feel comfortable walking in. They can take a breath of fresh air when they sit down and relax, and particularly with the spa. The spa, the whole idea about this is to really be able to get people in an expeditious way, have them come over at lunchtime if they want, have a cup of tea, just relax, take a breath of fresh air, get their treatment, go back to work, or any time in the afternoon they can do the same thing.
What should somebody look for in a medical spa that's going to be doing fillers, Botox, some of the laser treatments?
Well, I think the first thing is you want to look at the physician behind the spa.
Okay.
Are they actively involved in the spa? Are they actually involved in terms of the treatments? Are they involved in terms of the training of the providers that are in the spas? Do they have the background and training?
Do you think the public thinks that everyone's doing it the same? that they take for granted the art behind this?
I think there is a general perception of that, and part of that is driven by industry, sort of out there with the marketing and media type of things that they do. But, this is a very artistic area. I mean, there's a science part to it, there's an art part to it, and to try to take a cookie cutter approach to every patient is a big mistake. Everybody's a little different. Everybody needs to be evaluated in a certain way. You've seen how we do evaluations today with our busy analysis and making really good diagnoses about not only what the patients are concerned about, but going beyond that and sort of seeing what kind of conditions are going on with the patient that we can help them with to give them the overall youth that they're looking for. A youthful, more attractive appearance. They don't have to look different to get a good outcome.
Here we are in a treatment room with physician assistant Erica Chang. So your role here at the Maas Clinic?
I'm a physician assistant. I'm one of the providers here. We provide all kinds of different treatments. One of the treatments that we are offering is a cellulite treatment, and it also helps to spot reduce areas, helps to tighten and tone. It is called VeloShape.
So this is an FDA approved
This is
machine
an FDA-approved machine.
Approved to be what? To be effective?
It is approved to be effective for the temporary reduction in the appearance of cellulite. It also does help to circumferentially reduce the things that they worry about. How am I going to look in a bathing suit? How am I going to look in a short skirt? And this is one of those treatments that will help to reduce the appearance of the cellulite, give that lady a little extra confidence.
So you have to at least be an RN to operate this machine?
You need to be a licensed provider in the state of California. You need to be at least a nurse or above.
So it's ultrasound, radio frequency, what is it? What's
the technology actually is very interesting. It is actually radio frequency and light energy that is used in conjunction with massage and vacuum. The combination of those four ingredients actually helps to penetrate energy down to the fat tissue, which then of course causes lipolysis. So those ugly fat cells that nobody likes, it actually helps to shrink them.
So they're shrinking. So
they're
you're shrinking, and the FDA approved it for that procedure.
It is approved for that procedure.
So do people do that? They come in at lunchtime, get a procedure, go back to work?
Yeah, absolutely. And I think our location here in Pacific Heights in San Francisco, right off the Fillmore district, is just a wonderful place to do that. I'll have people come in and have a lunch or a boutique shopping event scheduled with their friends. They'll slip by for the Appearance Care Center visit and go down and have lunch at Harry's or one of the other very popular restaurants that are right in the neighborhood here. It's obviously, we have parking right across the street that's valet even. They can slip in and out of here within an hour and go about their business. So I think part of the kind of design, if you will, of the whole spa concept is to make it accessible, make it a nice and friendly place to go, and a place where anybody can have a good time after they leave here for some of these minimally invasive treatments.
So I'm a mother of two fabulous little boys, and I work here at the Appearance Care Center at the Maas Clinic. I think, first of all, I think anybody who's had, any mother out there who's had children and has lost their baby weight, because I think what happens so often is you lose your baby weight and you're thin again. You can fit in your clothes, but when the clothes are showing a little too much, when that shirt rises up above the belt and that skin is there, surgery isn't going to take care of that, or you don't want to go through an expensive surgery for something like that, and you think exercise will help. All the sit-ups in the world don't. This machine tightens it right up. I was one of the first patients to try VeloShape. I had some skepticism about how can I take this body that had two little boys, two big babies, and the skin's not exactly the way it used to look. I thought there's no way a machine that has minimal downtime and no pain is going to decrease the circumference, so kind of make you look like you are a little smaller. I had about 4 treatments, about 15 minutes, 20 minutes each time. No pain, just a little kind of tingling sensation, a little red. And I have to say those jeans even feel a little looser because, again, like I said earlier, you lose a little, feels like you're losing a little weight. Maybe you want to fit into that little black dress for a holiday party. It's a good idea. But I think just in general, I mean, for the legs, for the arms, any part of your body that you're feeling is just a little loose, and you're working out, you're drinking water, you're doing everything possible to be in shape, and you just can't get rid of that maybe extra dimpling or extra, in my case, skin, this really helps. I am now looking fabulous in a bathing suit.
Are there people that self-diagnose and they come to you as a surgeon and they say, I need to, they think they need a facelift and really they need some of these other procedures?
Oh, absolutely.
Does it ever happen?
Absolutely, and that's the value of using digital photography, computer imaging, which we do computer imaging analysis for people, and the Visia analysis, which you'll see.
You're big on this Visia.
I think Visia
You like
it
it.
is a great Here's the things that Visia offers us.
Because I'm not clear, by the way, on the big benefit of this.
Okay, Visia offers us a baseline photograph that shows us both wrinkle density, if you will, their thickness. It shows us dyschromia or brown spots. It shows us pore size. It shows us bacteria counts for people who have acne-related problems. And then whatever intervention we do, whatever treatment plan we develop based on our clinical assessment of the patient, our examination, our photographic assessment, which includes Visia, we can always have that patient come back and we can do another Visia analysis, another photo.
So comparative study.
Which is just a photograph, but done with a special device, and we can graphically show the patient how much improvement we've seen. So it's just another tool. I'm not saying it's the end-all, be-all, but certainly Visia gives us another tool for both diagnosis and management and analysis of our success. And the biggest success, obviously, for all of our patients is how they feel about themselves.
So this room is used for diagnosis
Correct.
of the skin problem.
Correct. Yes, it is. This is our Visia consultation room. As you can see over here, this is our Visia complexion analysis machine.
So a patient actually walks over there, sticks their face in the machine,
Yes, they do.
and it takes a picture.
Correct. Basically, we take two pictures. One is basically of their complete face, and then the second photo we take is basically a UV photo. With those two photos, then we do a mapping of their skin.
And that gets loaded into here.
Exactly.
And this is your role. I mean, this is one of the things you do. You do it every day.
Do it every day. I can see anywhere from 2 patients to 10 patients a day doing this. And so basically with that, I will go ahead, do an analysis for the patients. And
So the patient, you show them, like, this is a patient.
do, exactly. This would be a patient right here, and we've got 6 different areas that we're looking at, whether it be spots that could be seen topically on their face. We can look at pores, we can look at bacteria, any sort of wrinkles, texture, and UV spots. My first consideration when I meet with a patient is, what is their concern? What are you here to see
What do they
us
usually
for?
say?
It's generally a discoloration of their skin and or wrinkles. Those are the 2 most common
So
things
why
they
is this
see.
so important? I mean, does it allow you to match up the technology with their skin problem?
Well, Randy,
what's
what
the
it
big
does,
benefit here?
it gives me a real objective point of view to show the patient. I can sit here and I can look at you and go, oh, Randy, maybe a little Botox here, or, maybe a little skincare or IPL done here. But this really gives me an objective point of view to point out, show to our patients, this is what's going on with your face. These are the percentiles where you rank within your age group.
So this tells you if you're 40,
Yeah.
that you have more sun damage.
With somebody in your own age group, whether you have more sun damage or less sun damage. So it could be a real great thing, or it can be a very kind of,
Nice.
expose
So it
as
gives
to
you
what's going on.
A baseline then
Yes.
of the starting process.
Yes, it does.
And you use it to reference after they've had several treatments?
Correct. What I do is, again, after they've gone through the treatments, upon the recommendation of myself and then conferred with one of the providers, they come in, and after I do a consultation, they'll come in and kind of confer, and as well as make their recommendations, set the treatment plan down. And then after that they've gone through several treatments, we come back. We've got a baseline now, and we can see where they're going. After that, if we need to make adjustments in the treatment plan, we can do that.
Very interesting information today. Botox. Everyone is now taking a closer look at Botox, especially if you want to look better, you want to flatten out those lines, and even get a raised brow effect. Now, one of the things that Dr. Moss pointed out to me, he said, Randy, Botox doesn't do all the work. that there is technique involved. He says he teaches doctors that have been doing this for years and years, even from the beginning, the onset of Botox coming out. He does a full course, a full day course, showing doctors how to pick it up, how to take it to the next level, okay? What you need to look for in a provider that's going to be doing your Botox. Very interesting. You want to listen to this.
See so many people out there that are immobile. You know, they've got flat foreheads, they don't move at all, they have no lines, which is great, but if you don't have an expression and you look frozen, it's ridiculous. For her, we have a strategy to keep her looking very natural. We don't need the sort of frown, angry frown between the brow. There's nothing, as I tell all my patients, there's nothing socially beneficial about making that expression. But in terms of her horizontal lines, all we want to do is just soften the motion a little bit. We don't need to make her so she has no lines. We just don't want to make those lines deep and ingrained. And we want to keep her expression and keep her beautiful eyebrow position that she has. So that's the strategy that we're going to do for Jenna and get her out of here in 5 minutes and have her looking great in 3 days. Well, there's a lot of differences, I think, you know, in terms of technique now. I mean, a lot of if you look at even the doctors that are sort of following the formulaic package insert on the Allergan thing, it would have you injecting here up above her eyebrow. And what that does is it drops the middle part of the eyebrow down. It weakens too much of the muscle that lifts the eyebrow. And they do get an arch, but it's a funny sort of evil-looking arch. It doesn't look good.
Oh, I don't want that.
And we've seen that. I just was commenting on one of the television shows recently on a couple of the actresses on Desperate Housewives have that look where the eyebrow is down in the middle and swinging up on the side. It's arched, but it looks like you're evil. I don't understand why and they've obviously had Botox. So this is all about strategies to just relax the muscle that pulls the eyebrow together so we don't get these vertical lines and we don't make that angry frown. With the filler technologies that we have, the injectable fillers that used to be just collagen, now we have Restylane, Perlane, Juvederm, there's Evolence and Radiesse that are out there. And for people that like to take one tool and think it applies to every sort of problem on the face.
People meaning other practitioners?
Sure. I mean, other practitioners will say, I only use Juvederm, for example.
When you hear that, what does that make you think?
I think it's silly. I think we have all these different tools that really have different applications even within the same patient. For example, we'll have a patient that might need a little bit of filler and have a fine line. We'll use a filler for the deep fold and then a fine line treatment on the surface of that with a filler. We might use a combination of 1 or 2 or 3 fillers and a little bit of Botox. Still very cost effective and still things that people can walk in and walk out of here and go have lunch.
I'm Dr. Ronnie Spudich. I have a degree from the Yale University School of Medicine, and I completed 2 years of surgical plastic surgery training before I came to work with Dr. Moss about 1.5 years ago here at the Appearance Care Center at the Moss Clinic. There are many options for resurfacing. Some of this is light chemical peels, which involve no downtime for the patient. That works really well for people who have busy schedules and who do not have time to sort of hide out while their skin sloughs off, which is what happens with some of the deeper procedures. And there's a number of very nice options that we have. Glycolic acid peels, salicylic acid peels, and other acidified amino acid peels, which are applied. A patient would come in, come sit in this chair, relax. There's a bit of a spa-like atmosphere. Over here on this counter is an example of the glycolic acid peel that we offer. I do these peels, as do the nurses and the physician assistants who work here. And these are very nice for just refining the skin texture. They're a great adjunct to your normal everyday skincare. For someone who comes into me, however, with both pigment from sun damage, for example, and also is complaining of deep lines, wrinkles, skin texture, acne scarring, acne in general, and would like something that addresses all of these with a more aggressive treatment, something that they can really feel like something was done at the end of the day. The two great options for that are both more medium to deep chemical peels or fractionated carbon dioxide resurfacing. This here is the fractionated resurfacing machine. The benefit of doing the fractionated resurfacing, it's one of the newer technologies available, is that the downtime is much less than for a chemical peel. Another wonderful thing about the ActiveFX machine, many of you have probably heard of Fraxel, which is another fractionated resurfacing using a different kind of gas called erbium, is that one ActiveFX treatment is equivalent to 5 Fraxel treatments. So instead of 5 treatments where you're waiting 5 days to recover from each of them, you just have the one treatment where you only wait to 5 days in total. This is the head that we use when we're treating patients with the ActiveFX. It takes about 15 minutes total. We would anesthetize you with some local anesthesia and you would sit in the chair, and we would do about 40 or 50 pulses over your entire face. Again, it takes about 15 to 20, maybe 30 minutes, depending upon if we're doing the deep FX as well. You would have about 5 days of downtime, during which time you're applying an occlusive dressing that we would provide for you. At the end of that, all of the sloughing of skin should have occurred, and at that time you can apply makeup again and go back to work, and the process of collagen regeneration, etc., will continue for about 4 to 6 months. So once again, this is an excellent treatment for people with both pigment from sun damage over the years, which many of us have, and also for fine lines, deep lines, acne scars, all one shebang. So we're big fans of ActiveFX here in this office.
In this next segment, we're going to take a closer look at intense pulse light treatments, or as they call IPL. One of the things Dr. Maas pointed out to me is that as a person ages, reds come out, brown spots occur, you get larger pores. One of the things that this intense pulse light technology does is it targets the pigment, heats the underlying tissue, so it helps with collagen, it also helps with pore size. But this is a very important point that we learned today, and that is that all technology is not the same, and that advances, even in the last 12 months, have made it so that people with dark skin can now take advantage of the benefits of these intense pulse light procedures. So what is your role here? I mean, you're a registered nurse.
I'm a nurse, yes. My role here is to help oversee providers and patient care. So I'm a registered nurse. My background is women's health. So I come from an extensive education of women, hormones, aging.
Okay. Now your most popular
process.
machine. I should also mention,
Yes.
by the way, because we're live right now, that this hum, this loud hum, is the machine.
It's the actual
So it's
machine
working.
working, exactly.
So you say this is the most popular machine?
By far. We call it a 3-in-1. We're able to customize treatments for our patients. This is the cutting edge laser now. It's a light-based treatment, so the paddle is much larger.
So that's an IPL? That's what you,
IPL,
that stands for what?
Intense pulse lights.
Intense
Yes.
pulse light.
So it's not a laser.
And what's
it's
that good for?
This is good
IPL?
for browns, freckling, sun damage. Can also deal with reds and rosacea, vessels, any flushing of the skin caused by sun damage and aging. Mostly sun exposure, and we're able to really smooth the skin out and give it a youthful appearance again.
Okay, now you have great skin, by the way. Do you use this machine?
I sure do. I
All
sure
right.
do.
Now, so you do it to yourself, or you have somebody else do it?
It varies.
Okay. So the
Yeah,
second head.
This
what is that?
paddle right here is for laser hair removal, which has come a long way. This third paddle here deals with vessels, facial vessels, leg veins, which we also inject.
So what about little
Capillaries, very
around
common.
the nose?
Yes, anything on the face we can get rid of. Unfortunately, things tend to come back slowly as we age, but if you get maintenance treatments, maybe once, twice a year, we can zap what's there, get rid of it, minimal downtime, you're out the door and it's gone.
You've been watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Well, this week we talked about medical spas, what a medical spa is supposed to look like. And as a recap, that since there's over 2,500 medical spas throughout the U.S. and it's growing every single day, look for one that is run by a real medical doctor, one that is on site there every day, that are board certified in their recognized specialty, facial plastic surgeon, board certified plastic surgeon, and even a board certified dermatologist. Make sure that they have all the new technology, because all technology is not the same, and that the staff that they are using, whether they're doing Botox or a registered nurse that's doing some of these treatments, that they have a lot of experience and that they've been trained, that they go to continuing education. Because your face, if that's what you're going there for, the pricing is about the same wherever you go. You might as well go to a place, a facility, a medical spa that is a real medical spa, that this is their specialty. But I think that this is the important note. Look, everybody goes and they want to get the right procedure for them. And if you go to a place that only offers minimally invasive, this is my take-home message, this is what I learned from Dr. Maas. If you go somewhere that all they have is lasers, you're going to be offered only lasers and what they can do for you. Or if they only have IPL, or all they have is fillers to offer you, or Botox, that's what you're going to be offered. But when you go to a center like the Appearance Care Center, and throughout the United States, not everybody has a luxury of going to San Francisco, but go to a center that offers both surgery, low downtime facelifts, and all of the minimally invasive things that we've talked about today. So that's our advice. And if you'd like to see this again online, go to our website at wellnesshour.com. Just put in Dr. Maas if you'd like to direct a friend to it. That's this week. We'll see you next week.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.